I welcome you all to the today's panel discussion. It is a pleasure to have you all here. As Paul Arthur once said, for he who has hope and who has hope has everything. Public health is a global public good and a basic human right. Revolutions in our economy, in agriculture and in technology have changed how we act, think, and live. Inevitably, our health outcomes have also improved. Average life expectancy is now about 68 years. Diseases such as polio and smallpox, which once claimed so many lives, have now been defeated. Primary and secondary healthcare facilities have undergone a change for the better. I would also like to share some highlights from the budget 2021. Now, India's expenditure on healthcare stood at 1.2% of the GDP. Government announced rupees 64,180 crore for strengthening the existing National Health Mission. It also announced launch of Mission Portion 2 across 112 aspirational districts. And Ministry of Ayush was allocated rupees 2970 crores, up from rupees 2122 crores. In the past decade, Government of India has done tremendous work. India today owns world's largest health insurance scheme, PMJAY, Pradhan Mantri Jan Arogya Yojana, which provides health coverage up to rupees 5 lakh per family per year for secondary and tertiary hospitalization to around 10.74 crore poor and vulnerable families, that is approximately 50 crore beneficiaries, and many more terrific schemes. The immense work being done in the field of healthcare is quite evident from a very recent example of India completing 100 crore vaccinations against COVID yesterday itself. Isn't that a proud moment for us all? Not to forget, India launched its own vaccine against COVID while the entire world struggled with the pandemic. Now, moving on, let's start our panel discussion for the day. My first question to Dr. Amarji. When we talk about healthcare policy, sir, what is the direction that needs to be taken to achieve better health outcomes? I think we lost Dr. Amarji. We'll get back to him later. May I pass on the same question to Dr. Kirti? Dr. Kirti, can you hear me?
Can you repeat, madam, that question?
Yes. When we talk about healthcare policy, sir, what is the direction that needs to be taken to achieve better health outcomes?
Okay. See, I feel very saddened by the fact that a lot of things are happening on the curative side. Already people are suffering, and our governments, our policymakers are busy in addressing those. But at the same time, there is no thinking about the preventive aspect, where you can prevent, how we can prevent, which is a very big area, excepting the vaccination program, which is just one aspect of prevention. The rest of the preventive care areas are not being looked after by anybody. In fact, very recently I was in rural India. My thinking is, healthcare system alone cannot do anything for preventive health. I think it's people, it's our children, our schools, our colleges. All these youth and students need to be oriented on preventive health. And if we can do that, probably our load, our burden on curative health will drastically come down. And that is what a healthy policy is in healthcare for a country.
Thank you so much, sir. Moving on, I would like to go to Dr. Madhu. Next question. When we look at the data, there exists significant gender differential in seeking treatment, which is definitely not the same once the treatment is initiated. But there's no denying women still lag far behind in seeking treatment at the right time for socio-cultural reasons. How can we increase the accessibility and alleviate this impedance in seeking care by women? Over to you, ma'am.
Yeah, thank you so much. So at the outset, I'm really thankful to Dr. Virinder for inviting me here and to the chief guest here. And so I think for increasing the accessibility of women, and I've been working with maternal and child health area. So basic, what we have also learned from other countries as well, we have to go to the determinant, major determinant, which I found is the education of the girl child. So gender inequalities can be tackled, especially through women by, so first of all, we also have to focus on their education, because education then brings the woman empowerment. They can think about themselves, they can speak in their families, and also it brings along financial stability and financial power, financial independence. So they think, then they are more confident that they can, they are also, there are also their needs, and those needs have to be fulfilled. At the same time, we also need to work on the decision makers in the families, the husbands, the mother-in-laws, the in-laws with whom she's staying, so that the woman health is not neglected and it is not pushed to the lowermost priority in the household level. So this is because it's a patriarchal society, but at the same time we need to understand that women health should not be compromised, because she is also the backbone of the family. So, like what we have learned from National Health Mission, we had hired the ASHA workers at the village level, and we could improve the institution delivery rate by increasing the accessibility to the even to the remotest area through ASHAs. They did the behavior change communication at the village level, at the household level, and through the availability of free transport facilities, the ambulances which we could take to the remotest areas. We could bring women, especially pregnant women or the sick women, to the hospitals where they could be treated. So ASHA played a significant role, and now also Janani Shishu Suraksha Karyakram, we are providing free diagnostic and treatment. So financial barriers were also kind of alleviated by launching these schemes. So, and we have increased the accessibility of these services to, especially to the pregnant women and their children. So, but women is not only reproductive age group. She goes beyond that. And beyond that, we see there are problems of cancer, cervical cancer, breast cancer, which needs early screening. So, as already shown in the very beginning, that we can screen for cervical cancers, and with the technology, we can do that at the remotest area also, and especially for non-communicable diseases, because the burden is same in among women as well. So already there's a program going on, although the NPCDCS, for prevention of communicable diseases, but how best this can be implemented with the telemedicine facilities, we need to see that, and we can strengthen that in the remotest areas, so that once we empower the woman through education, make her more confident that they need, their health is a priority and it should not be neglected. And also we have a healthcare worker who also motivates them to go to the health facility at the very early stage. And we at the supply side also, we have those facilities where when woman goes, she finds that her health is being screened, she's being screened, and her issues are being tackled, and she's being given proper confidentiality and privacy. So especially if you talk about family planning methods, it has been seen that woman is just considered like I mean, their consent is not taken into consideration, especially if I talk about postpartum intrauterine contraceptive devices. So service providers orientation also needs to be a little bit changed, or they should be sensitized that women's reproductive rights should be taken into consideration, and consent should be obtained before giving them any family planning methods. So because sometimes we have seen that it's not only the women, their husbands or their in-laws consent is taken before sterilization or before PPI-ICD insertion. So what I want to highlight here, that to improve the accessibility, we also need to work at the societal level. So women's status in the society is associated with this. So that also needs to be changed. And on the supply side, from the health sector, we need to provide those facilities at the remotest area, where if the woman goes and the facilities are available. She's screened properly, and her diseases are being diagnosed at an early stage, and she's being cured at the early stage. Thank you so much.
This has been very nicely put forth by you. I myself, being a medical officer, we work in the rural areas, and this is the reality. This is the actual reality we see. Women seek consent of their in-laws even before going for family planning methods. So that definitely indicates that there must be involvement of all the sectors in a very efficient manner, which will bring us better outcomes. Moving on with that, I ask my next question. May I have this, Dr. Dheeraj? Dr. Dheeraj, how can we bring about better intersectoral coordination in addition to the existing schemes?
I'm sorry, I didn't get your question.
How can we bring about better intersectoral coordination to bring about better health outcomes? For those, we already have schemes existing for the same, but what else can be done to bring about better intersectoral coordination?
Well, I think within the medical fraternity, I think one of the most important areas that we work on in our institution is cold chain for pharmaceutical companies. So I think, if you see, even with vaccines traveling across the world, maintenance of cold chain becomes very, very important. Now, you would realize that, if a truck has to move a vaccine from, let's say, Sikkim all the way to Delhi, the road transportation itself is going to take more than 24 hours. And the discipline of maintaining the cold chain is not really followed in spirit in most situations. So, which of course has an impact on the efficacy of drugs. So no matter how good a treatment you give, the efficacy of drugs will suffer. I don't know how disciplined the drivers are. I don't know how disciplined the internet and technological systems which track the maintenance of cold chain from the manufacturing facility all the way to the distribution. And even more, I mean, at the retailing level, I don't know how many retailers in India have actually refrigerated facilities which they keep on 24 hours. Studies have been conducted in my institution at IIM Rohtak, where we have found that more than 50% of the chemists across the country shut off their electricity at night when they close the shop. So what happens to those drugs? So I think intersectoral coordination becomes very, very important from that standpoint. So you may be delivering cutting-edge healthcare, but the drugs which you are consuming, probably, if they are not efficacious, then I don't know what would be the outcomes, both clinical as well as physiological. So I think coordination between pharmaceutical companies, and even more, I mean, if we take it at the international level, the procurement of active pharmaceutical ingredients, our dependence on China is very, very high. Although the government is giving significant incentives to create pharmaceutical farms and pharmaceutical hubs, but the environmental regulations preclude many of the companies to actually engage in the production of active pharmaceutical ingredients in our country. So we continue to be dependent. So I think overall, for delivery of better healthcare outcomes, the intersectoral coordination is important and imperative. I hope that a broader spectrum of discussion between the healthcare providers and the manufacturers of equipments, the manufacturer of drugs, the retailers of drugs, I think the whole supply chain has to look into. As they say, the supply chain is only strong as its weakest link, and we have multiple weak links. That's all I have to say. Thank you. And I wish you the very best for this initiative. And I'm sorry I had to leave a little bit early, and I beg your pardon now as well. I wish you the very best. Thank you.
Thank you so much, sir. Moving on, I now move on to my next question. Dr. Kirti, as we all know, primary level of healthcare remains the most important determinant of efficiency of healthcare in context to India. What, in your opinion, can be done to bring more people to participate and revolutionize primary healthcare? Dr. Kirti?
Madam, can you please repeat, because there is some problem, I think. I'm not getting the question.
Sure. As we all know, primary level of healthcare remains the most important determinant of efficiency of healthcare in context to India. What, in your opinion, can be done to bring more people to participate and revolutionize the primary healthcare?
Okay. So basically, it's about the efficiency at the primary healthcare level. And my analysis and observation has been, because I travel a lot to the rural India, especially the eastern part and the northern part. So my observation has been that a mobile healthcare is the indicator, in the sense, I found, I'll give you a live example. I found there are beautiful primary health centers and community health centers established. But unfortunately, the timing of the farmers to the timing of the providers, the doctors, nurses, pharmacists, technicians, and all that doesn't match. That's number one. Number two, our population are not that aware to seek the services unless until it is painful. It is very severe. It's very serious. And as we all know, because some of us are doctors here, a patient coming at a late stage, even God can't help. Forget about the doctors. So my analysis has been the most efficiency we can bring in at the primary healthcare level if we can start mobile healthcare to the remote and unattended regions of our country, from the primary health center, from the community health center. If this mobile, fully equipped mobile healthcare units can be going to the remotest part, so that early detection, early identification of the catastrophic illnesses can be done, and hence we can prevent death and disability, all that stuff, and also we can reduce a huge amount of cost to the country.
Thank you, sir. May I float the same question to Dr. Madhu? Dr. Madhu, can you hear me? Okay, moving on, we have Shri Savesh Kaushalji with us. May I have the privilege to ask a question, sir? And since you would be the most apt person for this, we have this big question. Do we need more money, or do we need to improve our existing services?
Am I audible? Good afternoon to all of you, and thank you for inviting me today, and I'll be very happy to answer these questions. I think the one sentence answer is that we need both. When I go into details, see, there has been about 10% increase in the budget estimates for health services as compared to the previous year's estimates. But when we compare the revised estimates of the previous year with the budget estimates of this year, there's a net negative balance. That is because there's a finance crunch because of COVID, because of other reasons, or perhaps there are problems that we face all around these days, particularly pandemic, reverse migration, suppressed production, etc., etc. So I am very happy that the government has been able to maintain the continuity of its level of expenditure for health services. But there are certain areas where they are really much less than what they should be. I'm not blaming the government, because the money has to be allocated to different departments or different ministries according to the size of the entire kitty. One thing, I can point out many things, but since I'm only answering one question, one thing where I feel we need more money is in the research, in the field of research. See, in 2021-22, the Department of Health Research has been allocated 2,603 63 crores of rupees, which is definitely a 20% annual increase over 2019-20. The revised estimate 2020-21 is 93% higher than the budget estimate for the year. Now, see the problem, the consequences of lesser expenditure on health research is a big mismatch between the demand for money for research and allocation. It has impacted the terms of restrictions and sanctioning of new labs, providing recurring grants to the ongoing projects, upgradation of health research infrastructure. This has also led to repercussions in the medical research output. For example, in 2 years, that is 2015-16, I have the data, only 1,685 research papers have been published by the Indian Council of Medical Research, and 3 patents have been granted against the 45 patents filed. Unless we research, unless we innovate, I don't think we'll be able to meet the challenges. So this is, I just gave one example. There are 100 other things where I can. Now coming, it's since I'm answering a question, not delivering a lecture. Now coming to the second part, whether our services need to improve. Definitely, certainly, definitely. But it's not that our current human resource is not efficient. But everyone knows that we are working at less than the optimum degree of efficiency. There are very honorable exceptions in certain institutions of excellence like AIIMS, PGI, AIIMS and all. But in other areas, though there are shortages, but whatever manpower is available, it is not as efficient as it should be. And there are a large number of studies, corroborating what I'm saying. There are deficiencies also, which are affecting the services. We have to improve the services. We need to take up the human resource deficiencies. I would just give you one example. The Economic Survey of 2020-21 observed that aggregate density of health workers is 23 per 10,000 population, which is significantly lower than what is recommended by the World Health Organization. The WHO recommends 45 health workers per 10,000. We have 23. Well, we are a developing country and we are moving ahead, but with this type of human resource availability, we can't give the satisfactory services round the clock as people expect and as we are duty bound to do. As of 2019, there is 1 doctor per 1,511 people and 1 nurse per 670 people, which is much lower than the international standard. But we have very dedicated doctors working in government institutions. Private sector, we have very brilliant doctors, the cream of the profession, but there the affordability is the issue. They are rendering services to the select elite at a very high price. See, in India, there's a survey that the out-of-pocket expense over and above the insurance cover, including the Pradhan Mantri Sehat Bima Yojana, is 60% of the cost of ailment, which is very, very, very high. So most of the population doesn't have access to quality health services. One of the speakers who spoke before me mentioned that we need to have mobile health services which reach out to the people. Similarly, we need to have very strong telemedicine network. Similarly, we need to give a hand holding to the people in far off areas with empty pockets, because they are also entitled to health services as a fundamental human right. So we need the 3-pronged strategy: more money for health infrastructure and health personnel, more money for research, more money for improving the efficiency and standards of delivery of the already existent human resource by optimally positioning them and helping them with the technology tools to have a better outreach to the people, to the last man in the street. Thank you. Over to you.
There's one little thing I would ask you again. We have NSS volunteers. Can we have something like that, similar for healthcare, where we can have volunteers? They can be incentive based, because when we provide flat pay services, the efficiency is not that much. We have always seen incentive based services have always given us more outcome. Just like services, just like schemes like NSS volunteers, can we have something like that, so that more and more general public is involved in healthcare, specifically preventive healthcare?
I could partially listen to your question, but what I have made out of your question is to what extent the volunteers can augment the existing services in the public health domain. Is that the question? Is this the question? Am I audible?
Yes, sir. Yes, you're audible.
So the role of volunteers. See, as one of the illustrious speakers who spoke before me said, that if we nip the evil in the bud, we'll be saving ourselves from huge problems and huge engagement of the tertiary sector and the secondary sector institutions. We have to prevent the people from falling sick. In that, the NGOs and the volunteers, or generally enlightened citizenry, can play a very massive role. See, there are other things also. Health administration doesn't directly mean picking up a patient, treating the patient, and rehabilitating the patient through the health institutions. Basically, it also involves the Ministry of Social Security, welfare of women and children. We have to develop immunity in them, and we have to, and then water supply and sanitation. That is also a part of, though not directly under the health ministry or maybe partially under the health ministry, that's also a very essential ingredient of maintaining general health standards. So in all these activities, preventive public health activities, volunteers have a great role, NGOs have a great role. The only thing is we have to provide them the platform, and we have to show that we trust them. Yes, we can even give honorarium to them. Why not? But there can be free volunteers also. A lot of things can be done in this regard. Like now, some governments have started campaigns to, eradicate dengue through social participation. 10 minutes, 10 o'clock on a Sunday. I mean, let us scan our surroundings and do this. Similarly, Swachh Bharat is in itself a health outreach scheme. Cleaner environments will produce lesser patients. So we have to tackle whatever disease comes up as a challenge, but we have to go all out for preventing that sickness also, by building healthy women, healthy children, healthy citizens, healthy environment, clean drinking water, good sanitation, so on. I think this is what I want to say. Over to you.
Sir, it has been insightful and informative discussion. With this, we conclude our panel discussion for the day, and I thank our esteemed panelists for a terrific session. I'm sure all present here can agree that we have numerous takeaways from this discussion. Thank you so much to all the panelists for joining us. Now we move on to the last segment of the session. I feel honored to announce our awardees for the day. Our first awardee of the day is Shri Chetan Mukherjee who's being presented with Tech for Seva Leadership Excellence Award. He's a skilled lawyer with more than 2 decades of active practice at the Honorable Punjab and Haryana High Court in Chandigarh. In 2014, the central government appointed him as Assistant Solicitor General of India for the Honorable Punjab and Haryana High Court. He began his legal career in Punjab and Haryana High Court in Chandigarh in 1991, where he excelled in the field of law by appearing in a variety of major civil, commercial, and criminal matters and mastered the art of trial presentation. For 2 phases, he served as the Additional Advocate General at the Punjab Advocate General's office. May I please request Sarvesh Kaushalji to confer? May I please request Sarvesh Kaushalji to confer Mr. Mittalji with the award?
How do I do that online?
Just say a few words.
Mr. Mittal, we really feel it's a privilege and an honor to facilitate you for your achievements in the public domain. Kindly keep it up and add more value to your contributions that you have already made. Thank you.
Thank you so much, sir. I now invite Mr. Mittal to share a few words with us all. There's some technical problem at the end. Can you hear us? All right, moving on. Moving on with the announcement of next awardee of the day, Shri Arpit Chaturvedi ji and Ishan Chaturvedi ji. They're being conferred with Arogya CIBioD Award for Innovation and Enterprise Leadership. He's the author and strategic management expert with the Master of Public Administration from Cornell University's Cornell Institute for Public Affairs in Government, Politics and Policy Studies. He's founder and CEO of Global Policy Insights, a global think tank focused on governance, international political economy, and sustainable development. He also serves for both the Defense and Intelligence Norway as a senior expert editor of International Political Economy and Governance. He's experienced development consultant with a track record of success in the public policy arena. May I please request Shri Sarvesh Kaushalji to confer Mr. Chaturvedi with the award.
Dear Mr. Chaturvedi, it's such an honor for us to present this award to such an illustrious person having such wide academic as well as hands-on experience on public policy relating to health and other issues. We are indeed honored that you have accepted this award from us. Kindly accept it. Thank you. Thank you.
Thank you, sir. I now invite Mr. Chaturvedi to share your words with us all.
Thank you so much, Mr. Kaushal and the whole of the team for bestowing this award on me and my partner, Mr. Ishan Chaturvedi, is also here. We are glad to accept this award for the Global Policy, Diplomacy and Sustainability Fellowship, which is a global network of researchers, mentors, students who come together to deliberate on public policy, diplomacy, sustainability related issues. And with a special emphasis on health policy, because we really think that health policy in itself is a sustainability issue. It's a public policy issue. It's also a diplomacy issue nowadays with more of health tourism, health travels, health economics. With COVID now, creating new boundaries and blurring others. So thank you so much for that. Ishan, if you can just add a little bit to this, I think that would be great.
Thank you. Thank you, Sahasrabuddhi ji. Thank you, Dr. Kaushal. we really appreciate recognition at a level where we are trying to make as much impact in not just the supply side or the demand side of health policy, but all the things that are tangentially related to this very curious field that is a culmination of so many other fields coming together, as Arpit mentioned, but also an indicator of so many other fields, as well as the factor of how a country is doing, how a population is doing, so on and so forth. It is our pleasure to be receiving this award. And again, thank you so much for the recognition again.
It's an honor. Thank you.
To all the awardees. Moving on, it gives me immense pleasure to welcome our presiding guest of the day, none other than Shri Suresh Kaushalji. He is retired former Chief Secretary, Government of Punjab, India, with 38 years of experience in Government of India and Government of Punjab. May I request sir to grace us with the presidential address for the day, sir.
Respected Shri Sahasrabuddhe, Dr. Garg, and the organizers, thank you very much for giving me an opportunity to interact with the esteemed participants. Since we are already running late and the session must end at 1:30, I'll be very brief and specific. Basically, this session is for healthcare policy, for integrated development, Healthy Bharat. So there has to be a little bit more emphasis on policy perspectives. Some part of what I had to say, I've already said while answering the question. See, the basic policy for an integrated, healthy India is, as I said, we need to invest in infrastructure. We need to invest in human resource. We need to minimize the occurrence of disease through preventive intervention. And then we have to make the healthcare much more affordable. Well, even now, as per the estimates, 60% of the cost of disease, the treatment, is being borne by an average patient from his or her own pocket. Affordability is the issue. One's, heart pains, when we see appeals in social media that someone is sick, someone needs to be operated upon, someone doesn't have money, and they ask for donations. This has to end. This individual begging for life-saving treatments must end in due course. India has to march to that goal. For that, 2-3 things are very important. One is our brilliant engineers, biomedical engineers. Why can't we give them sufficient wherewithal to create the costly MRI machines and such big scanning machines and diagnostic labs, etc. Now the cost of diagnosis is so high. If simple tests, they cost 1,000 rupees or 500 rupees. Imagine a person who is earning 500 rupees for a family of 5 after an 8 hours labor. And if he has to get his family checked for various things, and the facility, either it does not exist or it is insufficient in government facilities, then he's gone. It is here that poverty pinches the most. One can go without food for a day, but how can one patient go without a life-saving medicine for a day? Number 2, we have to control the pricing of the drugs more efficiently. There is a regulation. There is drug regulation also, and there's this National Pharmaceutical Pricing Authority. Government's intervention in respect of various medicines has also been there and successful to some extent. But still, the cost of life-saving medicines and even other medicines, cost of medical equipment, implements, it's very, very high. The poor people cannot afford it. Now, even for drug pricing, I think these national commissions should have more teeth. I have the data of 2019. This commission sent 2,038 demand notices to pharmaceutical companies for having overcharged the patients on the sale of formulations at prices above the ceiling prices notified by NPPA. However, an amount of rupees 5,477 crores is still remaining to be paid, and an amount of rupees 4,033 crores is under litigation. Unless maybe we'll have to manage to manufacture APIs that we are importing from other countries within India, we have to be Atmanirbhar. Maybe we have to, as I said, we have to make our own machines. We have to make our own drugs, and we have to have somehow give some incentives to the doctors who are going all over the world for better remuneration and better facilities, or maybe better life. Then we have to spend a lot on telemedicine. We can very easily say telemedicine, but for that we have to give assured connectivity. The connectivity barrier is a major barrier, as we have now seen during COVID, even in terms of online education. We have seen that online education is no substitute to offline education. It's basically because the connectivity issues. Not only connectivity, there has to be a reliable hardware at the other end. We are not even running proper OPDs only, even OPDs through telemedicine all over. So therefore, a lot of things have to be done. The policy perspective as on today is not wrong. We don't say that policymakers have not visualized what I've just said. They know about these problems. That is why the targets, we are quite near to our targets. I was happy, though not fully satisfied, to read the NHM targets. The target was to reduce IMR to 25. It has been reduced to 32 in 2018. It was much higher earlier. Though we have not achieved the target, but it's coming down. MMR has reduced to 113. We want to bring it down to 100. TFR has reduced to 2.2. We want to bring it down to 2.1. Annual malaria incidence is 0.02 in 1919. Our target is, it should be less than 0.001. Then our target is less than 1% microfilaria prevalence in all districts. And out of 256 endemic districts, 99 have reported incidence less than 1% in 2018. That means we have to make more effort in the other districts also. Similarly, reduce annual prevalence and mortality from tuberculosis by 1/2. That was the target during 2012 to 2020, by we should have achieved it by 2020. So it has been reduced from 300 per lakh in 1990 to 204 per lakh in 2017. Progress is being made. Nobody can deny the fact that the government is very sincere, government is serious in making the progress. But a developing country and an overpopulated country has always got the limitations in terms of funds, in terms of trained manpower, and the resistance to change. That is also one of the factors. So we need to push the whole thing further and bring in more and more affordable technology so that the input-output ratio increases. 1 unit of input in the health sector should multiply into 10 units of productivity in terms of delivery. That has to be our goal now. That is why this Tech for Seva, for integrating science and technology in terms of public delivery, is very important. It's very important. This policy session is basically a non-technical session. And see how important is the health technology to other forms of education. I'll give you just one example. There is something called as neuroeconomics, which determines how consumers decide on what to buy, how much to buy, at what price to buy, what should be, what is the background of the prudence that a consumer uses in the market. And now economists have started analyzing consumer behavior, taking the help of the neuroscience models of the medical field, at how the brain works. So see, such type of integration is also required. So what I say is that fundamentally what is important is every penny that we spend in health sector, including in health research, yes, the money is less. But what I am emphasizing is that every penny that we spend in the health sector should get multiplied into 10 units of efficient delivery within the resource constraint. That should be our endeavor, and that should be the national policy. Thank you.
Very well said, sir. This truly emphasizes on the efficiency, how we should be using the resources. Thank you, sir, for enlightening us with the words of wisdom, and we are grateful for your presence today. And we promise to inculcate the knowledge we have gained today in the near future here at CIBioD. Now I request Dr. Shalini to present formal vote of thanks for the session. Over to you, Dr. Shalini.
I am thankful to Shri Jayanji for his presence today, and we are also thankful to Shri Kaushalji for really making this session worthwhile by sharing his knowledge and appraising us with all the recent developments and all about the policies of the health. And I am thankful to Dr. Shyam Sundar Patnaik ji, Dr. Madhu Gupta for being our panelist and the awardees for the session today. It has been a worthwhile, and knowing about the latest happening in our country, and we feel proud of the steps and the lot being done for the nation for making it a healthy nation. Thank you very much.